to another pathology on breast diseases, a discussion on breast pathologies rather. So just take a while and have a look at this clinical scenario. So it's a discussion on nipple discharge, and here it's a 40-year-old lady, and the duration is 4 months. So, like in any other instance, we have to take a history, then examine and think of investigations, what to do, and then for the treatment. And to take a good history, one thing at the outset, we should have a differential diagnosis. So, what are the causes for a nipple discharge? So, pause the video for a while and write down the differential diagnosis you think, and then you can check your knowledge of the knowledge of pathology that you already have by comparing the next the causes that I am listing. So pause the video, write down and see. So these are some common causes. One thing is that it could be physiological. With this I'll discuss a little later. Then mammary duct ectasia. Now this also usually happens in in the middle age group of ladies, and infections can be there. Then duct papilloma, which is actually a benign condition, and prolactin oma, actually it's a pathology in the pituitary, but by the prolactin secretion the manifestation may come as a breast presentation, and also carcinoma breast. It is not very common for carcinoma breast to present with nipple discharge, but of course there are cases that we have seen. And the physiological, during the childbearing age group, the females can have physiological secretions, and most of the time they come by expressing. When they just squeeze around the nipple areola, they get this physiological secretion. And also during pregnancy it is possible to have this physiological discharges. So then what is the history that we are going to take in order to arrive at a diagnosis? So one few important things are, of course, one thing is the duration is important, and then whether it's unilateral or bilateral. So because you will understand, if it's a bilateral, of course it could be a physiological, or it may be a prolactin oma. And if it's unilateral, it is more likely to be a infection, duct papilloma, or mammary duct ectasia. But of course mammary duct ectasia can affect both breasts, so it again could be bilateral. So with this unilateral or bilateral, it has an importance. So is unilateral, you think of these three more predominantly. If it's bilateral, it could be either. So and then, so supposing it is bilateral, how do you distinguish between a physiological and a prolactin oma? Then it's very easy, because physiological secretions mostly they are expressed or induced. That is, the patient squeezes the breast and the secretions come. But in prolactin oma, it is a spontaneous discharge, and usually it is a bit copious. It's a bit of sometimes troubling. So these two things, whether it's unilateral or bilateral, and whether it's express secretion or a spontaneous secretion, will guide you a lot to in the differential diagnosis. And also infection, of course there will be pain, and of course they may be having some fever, and also examination will show the signs of inflammation. But when you look at this just the flow chart, so if it's a but of course this I'm taking in a different direction rather than whether it's one breast or both. But anyway, if it's an express secretion, that is the person squeezes and takes, and if it's bilateral and there's not much of a color or just straw color, it could very well could be a physiological one. Very well could be a physiological, express and bilateral. But as I said, sometimes duct ectasia also, it is possible that it is happening in both breast and it is expressed. But what is important thing to understand, that if it is bilateral and expressed, it's nothing to worry. It could be physiological, at most it could be ductectasia. So expressed and bilateral, then nothing to worry for the patient. Supposing it is expressed and unilateral, and if it's straw color, it could be very well be ductectasia. And it is blood stain, it's very like to be a duct papilloma. The blood stain discharge, the pathology being carcinoma, it is possible, but the commonest cause for blood stain nipple discharge is a papilloma. But the important thing to remember is most of the time these papillomas, of course, when you express, you see the blood stain discharge coming, but generally they will have some spontaneous discharge also. So if a person comes and complains, they have a blood stain discharged. I have a blood stain discharge, so your most likely diagnosis is going to be a duct papilloma, but it could be a carcinoma. So in a duct papilloma, the usual history is that they notice that some blood stain, fluid staining their clothes, and also when they squeeze, they notice a blood stain discharge. And another important thing is, now in these physiological discharges, the secretion come from many ducts. They come from many ducts. But in a duct papilloma, it is usually it's in one duct. So always the patient will say the blood stain is, when they squeeze, it comes from one particular area. And of course, examination also you can have a look. In these infections, of course, you get a yellow color discharge. And also, if it is spontaneous and colorless, straw color, and bilateral, and if it's copious, you have to suspect strongly whether it could be a Prolactin Oma. But of course, during pregnancy also you may have a bilateral spontaneous, but most of this physiological one will be expressed. So, but coming back, the three important criteria in the history is whether it's unilateral or bilateral, and number two is whether it's expressed or spontaneous, and the color. Because if you look at these various pathologies, if you take one by one, physiological, it will be bilateral, expressed, colorless, or maybe a straw color. Mammary duct ectasia, most of the time it is unilateral, and generally the secretions are expressed unless there's an infection, and also that it will be a bit of a straw color discharge. Infection, unilateral, and you will have features of inflammation, and the color will be pus color, the yellowish color. Duct papilloma, it's unilateral, and there will be some spontaneous. Majority will complain of spontaneous, but you can express and see that the blood stain discharge is coming from a single duct. So if you see a blood stain discharge, single duct, very likely it's a duct papilloma, but of course could be a carcinoma. And if it's bilateral, spontaneous, copious discharges, it could be a prolactinoma. So when you combine these three factors, whether it's unilateral or bilateral, whether it's expressed or just spontaneous, and also the color, with these three characteristics, you can come to a sensible clinical diagnosis. And then of course this chart will give the various colors which are bit characteristic for various types of pathologies that we discuss. So you can pause the video for a minute and have a look at this, the various colors. So with this, the color is one important thing to as a clue, and also with this bilateral and unilateral, and with this spontaneous induced. So when you put these three factors together, you can come to your diagnosis. And then of course you examine the breast. So if an infection, you will see the redness, and of course there will be tenderness, and you may see a pus discharge. And in other cases, most of the time breast examination you will not find anything. But if it's a CA breast, you may feel a mass. But this is very rare that a CA breast will present with a with a discharge, but of course you have to keep in your mind. So examine, and then what are the investigations? So like any breast pathology, it is important that you do a ultrasound and a mammogram, and of course if you see a lesion, then that has to be guided biopsy. But as I said, most of so but and also by imaging, they will tell you, the pathologists will actually they can come to a diagnosis of most of these conditions. Physiological is by ruling out. Mammary duct ectasia they can see with your imaging. Infections they can. Duct papilloma they will see. Prolactin Oma, of course, it's a different issue, and also carcinoma breast. So with your imaging, you can confirm your clinical diagnosis. And then if it's a malignancy, of course you do uh, the biopsies, and also the secretions can be sent for cytology. And if you suspect a prolactinoma, that's a bilateral spontaneous copious discharges, a serum prolactin level has to be done, and if it's very high, of course you have to image the pituitary. And then the treatment, once you make the diagnosis, very straightforward. Physiological, you just reassure. Mammary duct ectasia, again you reassure. But there are some people who are really bothered with this discharge, and especially if it is complicated with recurrent infections, it is possible to treat with surgery. But in that case, the surgery is that of course you have to excise the mammary ducts. So you make a, it's called a Hadfield's operation. You make a subareolar incision and lift the areola upwards, and the underneath mammary ducts you excise. But if you're going to embark on this surgery, you have to make sure that the lady is not going to have any, doesn't plan any more future pregnancies, because after that you can't breastfeed. But generally this duct ectasia happens after about like 40-45 years. Most of the people would have completed family lives, but it's very difficult to say. So you have to counsel very well before you embark on that surgery, uh, because it is not essential to operate on this. Infections, just a matter of antibiotics, and if there's abscess, you have to drain it or aspirate. Duct papilloma, uh, that you excise that involved duct surgically and send for histopathology. So this surgery is called named as microdocectomy. Microdocectomy, where you remove the only the involved duct. Prolactin Oma, it's totally many from disease of the pituitary, which you have to treat surgically. So you need a neurosurgical referral. Carcinoma breast, the previous discussion, we discuss in length. So breast nipple discharge, of course, on and off you see people coming, and differential diagnosis we have discussed, which is seen here, and using three factors, whether it's unilateral or bilateral, expressed or induced, and the color of the discharge, you can make a clinical diagnosis. And with imaging and the required other investigations, and if necessary a prolactin level, you can confirm your diagnosis, and the treatment is directed to the cause that you find.